So, wow, look at how much we've learned. So, it started out with a plastic water bottle, and now you've got the analogy to understand all of these concepts. Let's do a quick review. The end diastolic volume, that's the amount of blood in a ventricle right before it starts to contract. How can you remember that? You know that diastole is the relaxation period, systole is the contraction period. So, right at the end of the relaxation period, that's when the ventricle is at its fullest, and the end diastolic volume is when the ventricle is at its fullest. The end systolic volume, the ventricle has gone through systole, it's contracted, and after it's gone through systole, there's still blood left behind, actually quite a bit usually. And so that's the end systolic volume. If you want to know how much blood left the ventricle, you take how much it started with, subtract how much is left over, and that volume is termed the stroke volume. So the stroke volume is taking the amount it started out with, EDV, subtract the amount it ended up with, ESV, and then you've got that. Now, you know the heart rate. The heart rate is just going to be the number of heartbeats per minute. If we take our stroke volume and multiply it times the heart rate, we get this number, cardiac output. Cardiac output's super important measurement of how well your heart is working. If your heart can't pump out enough blood, it ain't keeping you alive. So cardiac output is going to be the stroke volume multiplied by the heart rate. And since the stroke volume is equal to the end diastolic volume minus the end systolic volume, both of these formulas are accurate for cardiac output. But there's more. What else do we need to know? We need to know this concept, the ejection fraction. Now, one minor point, but it might be good to stick in your memory bank. The ejection fraction is always going to be less than 1 or is going to be a percentage. And why? Because the ejection fraction is what fraction of the total amount in the bottle, in the ventricle, what fraction of that was splashed out. And actually, moment by moment, as you're just sitting there, about half of your end diastolic volume is pumped out with each heartbeat. At the beginning of the last video, we were talking about how the heart can beat faster. Well, that's heart rate, but the heart can also beat harder. What does it mean for the heart to beat harder? We know what it feels like, right? Well, when the heart beats at its normal amount of oomph, then it is going to fill up pretty good and empty about half. So a typical ejection fraction is something like 54%. That means that a little more than half of the total amount of blood that was in the ventricle leaves as the stroke volume. But if your heart wants to, it can fill with even more blood and it can empty even more completely. And it would do that by increasing its ejection fraction. So if I asked you, what does it mean when the heart beats harder? You would say there is an increase in the ejection fraction. Or you could say there's an increase in the stroke volume divided by the end diastolic volume. A greater stroke volume per beat is often going to be related to an increase in ejection fraction. Now let's talk just a little bit about cardiac reserve. Cardiac reserve is the difference between what your heart does when you're sitting there watching TV and what it can do if you insist by exercising a lot, right? So if you are just sitting there, your cardiac output might be about 5 liters per minute. But if you start running on a treadmill, then your cardiac output would go up, generally speaking. How high would it go up? Well, that'll depend on how healthy your heart is, how well trained your heart is. That's what will affect your cardiac output. So let's do a little bit of, I don't know if I can do any drawing on this particular device. Normally I would draw on the whiteboard at this point. Let's go to a blank slide and see what I can do. All right, so I am going, oh, hold on. Okay, we got a blank slide. I'm going to get out my pen and I am going to make, oh, that's so terrible. I'm going to try to make a chart, all right? So this will be time. This will be time going this way. And this will be what my cardiac output is going this way, right? Now I'm going to draw a different line here. I'm going to draw a line in green. And this line in green, that is going to be what does my heart need to do? How much blood per minute? What cardiac output does my heart need to be able to create in order to keep me happy while I'm just sitting there watching TV? So that's going to be not very much. We'll say it's about 5 liters per minute. Now, let's have you on a good day. I'm going to change my pen color again. Yellow. Yes, yellow. All right. So on a good day when you're young, you're watching TV, you go walking into the kitchen, you go back, you're watching TV, then you go out for a run, your cardiac output goes way up, then you come home and you watch TV, all right? So your cardiac output could be super high. This difference between what your heart could do when you're exercising really hard and what it does just on a moment by moment basis, that is termed your cardiac reserve. And when you're young, particularly when you're young and also fit, you have got a tremendous cardiac reserve. Now, let's talk about someone who is old. They've already had a heart attack or two, and now they're in heart failure. But on an average day, they'll be watching TV, walk into the kitchen, go back, watch TV. And if they exercised as hard as they could, what could they do? Well, let's say at the beginning of their heart failure, this is how much their heart could pump when it's working as hard as it can, okay? Not as much as when they were young, but it's still got some cardiac reserve. But over the next 10 years of their life, this is what their heart can do when it's trying as hard as it possibly can, right? People will come to a moment when they've got heart failure where the difference between what their heart must do to keep them alive and what the heart is capable of doing if it is asked to do more is very, very small. We would say these patients have lost their cardiac reserve. And in that situation, the day will come when what their heart can do when it's trying its hardest is actually less than what is required to keep the patient comfortable. And then we sincerely have got a serious situation with heart failure. This situation right here that I'm describing, this explains why you can have a patient that's under your care as a heart failure patient, and man, for 5 years, 6 years, 7 years, they seem to be doing just fine. And then they'll come in 1 month and they will be seriously out of breath just walking in from the car. If they're seriously out of breath just walking in from the car, you know that their cardiac reserve is very, very small. I've got a student here that wants to meet you guys. Hello. Hi. I'm Daisy. All right. Bye, Daisy. All right. So cardiac reserve and cardiac output. Now, related to cardiac output, you'll notice that all of these measurements are for one ventricle. Why is that? Why not for the whole heart? The reason why these measurements are per ventricle, not for the whole heart, is that the two ventricles have to be completely synchronized. We measure each one because they must be completely synchronized. Let's just imagine that I've got 2 buckets of, blood. That'd be weird, but okay. One is going to represent the systemic circulation. One is going to represent the pulmonary circulation. This is going to be the right side of the heart. The right side of the heart takes blood from the systemic circulation, just came back from the vena cava, and puts it into the pulmonary circulation, into the lungs. Simultaneously, the left side of the heart takes blood from the pulmonary circulation, the pulmonary veins, and sends it out into the aorta, the systemic circulation. Now, you can recognize that if for some reason I was taking 2 cups of blood and taking it from here and putting it over here, but over many minutes I was only taking 1 cup from here and putting it over here, well, this bucket is going to overfill. Now, honestly, the pulmonary circulation is very small in comparison to the systemic circulation, but that doesn't matter. Every time 2 cups of blood goes from here to there, I need 2 cups of blood to go from here to there. If that is not the case, if we have got what's called unbalanced ventricular output, then one of these buckets is going to overfill. What does it mean when a bucket inside of the systemic circulation or pulmonary circulation overfills? These are the 2 things that can happen with unbalanced ventricular output. Both of the ventricles are designed to send out the same amount of blood every time they beat. As a matter of fact, it's coordinated by something you're going to learn, and I hope you will memorize and keep close to your heart for the rest of your life because you'll need it, called the Frank-Starling law of the heart. But if they're not balanced, if something goes wrong with that system, what will happen? Well, if that bucket of blood that represents the pulmonary circulation, if it gets overfilled, if it overfills, fluid spills out, and the watery part of the plasma, it is going to drain out of the pulmonary capillaries, and it'll start to fill up the airways in the lungs, and you will get fluid in the alveoli of your lungs. There's only supposed to be really pretty much just air inside of your alveoli. If there's fluid and air in your alveoli, you are drowning. You will periodically hear of patients drowning in the hospital because their lungs aren't working right. And one of the reasons that can happen is this pulmonary edema. Pulmonary edema would happen if the right side of the heart is working fine, but the left side of the heart can't keep up. So when right ventricular output exceeds left ventricular output, this happens when the left ventricle is failing for some reason, and you'll get pulmonary edema. The other thing that can happen is when the right ventricle is failing. When the right ventricle is failing, then the left ventricular output would exceed the right ventricular output, and pressure will back up in the systemic circulation, and you'll get systemic edema. What does that look like? That would be heart failure patients whose feet have begun to get swollen, or they're starting to accumulate a lot of water inside of their abdomen, a problem known as ascites. One of the causes of ascites, one of the causes of swollen feet and legs is going to be unbalanced ventricular output, and this would happen if the right side of the heart is failing. We are going to pick that up in the next video. We're going to pick up here in the next video, but in the meantime, let's answer this question. Cardiac output is what? Heart rate by blood pressure? No. Ejection fraction by heart rate? No, but close. Stroke volume by heart rate? Okay, wait a minute. That sounds right, but let's keep reading because Tidal is tricky. Heart rate multiplied by the end diastolic volume minus the end systolic volume. Well, wait a minute. What is the end diastolic volume minus the end systolic volume? That's the stroke volume. So heart rate by times this is the same as saying heart rate times that. So both 3 and 4 are correct, but you knew that. I'll catch you on the next video.